enter the room.
Good evening. I'm Dr. Niveta Mahadevan, GMC number 8011337. Shall I proceed?
Yeah, again.
Yeah. Hello, you must be Mr. Aaron Rogers.
Hi, doctor. Hi, I'm Aaron.
Hi, I'm Dr. Mahadevan, one of the doctors in the GP practice. So, can I please know your age?
I'm 75, doctor.
Okay. So, Mr. Rogers, I can see that you have some concerns and you wanted to talk to one of our doctors. So, how can I help you today?
Yeah, doctor, I'm a little worried. So I found this lump. This
Okay.
will, that's all. I just wanted to talk about that.
Okay. So, you mentioned that you have a lump. So, can I know where is it?
It's at the back of my neck.
Okay. Okay. So can I know for how long have you been noticing this lump?
It's been a while, doctor. Like it's been almost 4 or 5 years, I'd say.
Okay. So are you having any pain because of it?
No, no pain, doctor.
Okay. So is there any discharge or any bleeding have you noticed?
No, doctor, nothing.
Okay. So can you just point out to me where exactly the lump is?
Like at the back of my neck, like in the right in the middle.
Okay, okay. So, as you mentioned, as in the back of the neck, are you having any problems with the movement or is it affecting you anyhow?
No, not really. It's just always there. Not having any problems.
Okay, okay. So, so I would like to ask a few more questions. Is that okay?
Okay.
Yeah. So, do you have any medical conditions that I should know about?
No, like what, doctor?
Like any long term, like any high sugar or high BP or anything?
No, no, doctor.
Okay. Are you on any medications?
No,
Okay. So, do you have any allergies that I should know about?
no, doctor.
Okay. So, other than this lump, is there anything else that is concerning you? Anything else you want me to know about?
Like what, doctor?
Anything that is worrying you today? Anything that we have to look after?
Now that you, I mean, I actually came because my friend, recently had some
Mm-hmm.
skin. I'm not sure what, but for something like this only, he had it for 4 or 5 years, and then suddenly they said it's cancer. So
Okay.
it's about that.
Okay. 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 So I can see your concern. So I'll be answering it to you in a minute. Okay. So can I know what do you do for a living?
Nothing. I stay at home.
Okay. So is there any sun exposure? Are you out in the sun or anything like that?
No, no. I just like to sit inside only.
Okay, okay, okay. So, have you been experiencing any fever recently?
No, doctor.
Okay, any loss of weight?
No, doctor.
Okay, any other? Have you noticed any other lumps and bumps in your body other than the neck one?
No, doctor.
Okay, so can I know if you smoke by any chance?
No, doctor.
Okay, so do you take any alcohol or anything?
Very rarely, maybe once a month.
Okay, okay. So, Mr. Rogers, I would like to examine you now. I would like to take your observations and I would like to take a look at the bump. Is it okay?
Okay, sure.
Yeah.
So general examination is normal. With the lump.
Okay. 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 So, Mr. Rogers, I have taken a look at your lump now, and from the chat we had, I suspect that you have a condition called as lipoma. Have you heard about it?
Oh, no, doctor, what is that?
Okay. So, as you mentioned to me, you had this bump and you don't have any pain or any bleeding, or you're not been experiencing any other symptoms like fever or loss of weight. So, I suspect it to be a lipoma. So, lipoma is the accumulation of the fat cells in our body. So, they just get accumulated into a lump, and it is there's nothing to worry about it. Okay.
Okay. Okay, so it's
So,
not cancer.
yeah, it's highly unlikely that it could be a cancer. As you mentioned to me, you had that worry. It doesn't seem like one. We can do some investigations. We can try ultrasound scan of it just to see how it is.
Minutes remaining.
Sure, doctor. Okay.
And we can just know about it, but I highly think that it's very unlikely that it could be a cancer, but we can confirm, we can make sure that it's not one, as you're worrying about it. So this lipoma is quite benign and we need not worry about it. So there's need not be any treatment for it. So do you want to ask any questions?
You said it's fat cells, right?
Yes.
But it feels very hard, doctor, when I touch it.
Okay. Okay. So as you mentioned that it feels a bit hard, we can also we can try a biopsy of the lump just to make sure we don't miss anything sinister. And based on the biopsy reports, we can see how it goes. For which I can refer you to a dermatologist in under 2 weeks pathway, and they may see into the issue, and they will make sure that there's nothing wrong with it. Okay.
Okay, doctor. But if
Yeah.
it is cancer, uh, what what do you think? Will I die?
Okay, your concern is really valid. Please don't worry about it. So, if we find out that it's a cancer, we have many options for it. We can give radiotherapy or chemotherapy, or we can also do a surgery and remove the lump. And we'll do some scans to see if the cancer has spread anywhere else. So, there are many options available. You need not worry about it.
Okay, sure,
Is
doctor.
that okay?
Move on to the next station.
Sorry about that. Ale, that was great.
Yeah.
That was
I was a
really nice.
bit nervous.
That's all right. That's understandable. But you asked all the questions. But what is the thing that you forgot?
Uh, I couldn't think of anything.
What is the thing that I suggested after you gave the diagnosis?
Um,
I said it's hard,
are you?
right?
Yeah, 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 yeah.
Hmm. That's something that could have helped you make the diagnosis. Do you still think it's lipoma?
Yeah. No, it can be something sinister. Yeah. So I should ask about the consistency of the lump or how it is felt.
Exactly. So always explore, always expand your, you know, the
Mm. Presenting
presenting.
complaint.
Yeah, and you directly went into closed question, right? What was the first thing that you asked
Mm.
me as I said I have a lump? You said where
I
is it?
asked where is it? How long is it?
So what should you have said?
Um,
Tell me more.
more
Tell me.
about the lump.
That's all. Just tell me more. That's all you always. That's how
Mm.
you always open. So you always start with an open question. That'll give you so much more information than what you could get with your closed questions. Your closed questions might be completely wrong. Also, you never know.
Yeah,
Right?
yeah,
Um. Yeah. All right. So yeah, examiner will give you feedback.
yeah, sure.
Hi, hello Niveta.
Hello.
All right, I have to say that was a great attempt, and I feel like you had a very strong start, but you eventually, lost your way somewhere there.
Yeah, yeah. I couldn't find out what it was, so I was confused a bit.
Right. Your data gathering was almost perfect, I have to say, because you asked all the important questions that needed to be asked for this particular case. So you started with the full name and age, the identifiers, which is important, and
Mm,
got marks for that. And so you elaborated the presenting complaint. So elaboration of the presenting complaint, basically you have an ABCD rule, right? Appearance, color,
mm,
depth, right? So you could have asked how it,
mm,
definitely they must have touched it, right?
mm,
Look, what is the skin changes over that?
mm,
But then you asked like a rash history, like since when,
mm,
how long is it growing? Do you have any sun exposure, discharge? Uh,
mm,
you could have
mm,
also asked trauma. You asked pain, but that was a
mm,
good data gathering about the presenting complaint.
mm,
Uh, because initially the presenting complaint was that I'm worried about the lump. So the first thing your head should go to is where is the lump exactly? This because it
mm.
could as easily become like an STI case, right? And
Yeah.
yeah, so you're actually ruling out a whole lot of differentials by just asking that one question. All right.
Mm,
So, another important thing that you asked was how is it affecting your life? That is
mm,
absolutely vital for this particular question. I mean, sorry, station, especially
mm,
because this would be ultimately this was supposed to be a dermoid cyst. All right.
okay.
So dermoid cyst is again, as we all know, it's actually a benign cyst, and the
Mm,
only reason you will actually do surgery is if it's actually causing any life effects, right? If the
okay.
patient would be difficulty in moving his neck, but then you should also remember it's right at the neck, right? So it
Mm,
and
mm,
tendency to keep growing, so it could also compress a lot of vital structures, right? So
okay.
looking at
Yeah.
itself, that's what should come to our mind, like this is,
Mm,
we can't make a decision whether or not needs to be operated. This should be made by the surgeons, right? That's the treatment
mm,
he will get as soon as he says about the location and everything. But
okay.
I think in the examination we should have incorporated a little more findings, like it is hard without a punctum, and
Mm,
no fluctuation test. That way you would have a better idea, right, that I know
yeah.
this
Mm, mhm,
lipoasis, dermoid, I know just by the image alone. But
mm,
yeah, so any one of these cases, especially if it's on the neck, how would we go about it? No matter what your diagnosis was,
mm,
I think it could be a range of things to myself. What could be your diagnosis? That we'll talk about in management. So, in the beginning, how is it affecting your life? Because you're trying to understand whether or not this person will require surgery, but you feel like he will require surgery because it's on the back of his neck. All right. So, more about this person so that you understand that what is the kind of treatment you want to offer him. So, a little bit about a PMAFTOSA question. Is it a past medical
mm,
history, medications? Does he have any family history? Because neurofibromatosis can also happen.
mm,
Is his occupation? Does he have sun exposure? Is he like an avid drug user? Something about his lifestyle. So
mm,
I didn't give you marks for this other thing where you asked him directly, do you smoke? Like
mm,
I did this one station with Dr. Rohit took, and he beautifully said how you should transition from one line of questioning into another. So
mhm,
if you're already asking him normal questions, and if you're going to ask him some personal questions, which is out of your line of questioning, always signpost those. All right, I'm going to
okay.
ask you about your lifestyle. This is important for my consultation. All right. So,
Mm,
saying that, he would be ready for something, it won't just throw him off, right? You're trying to
mm,
make the person who you're talking to feel comfortable, not ashamed. I mean, that is
yeah. Okay.
if you, suddenly change the questioning like that. All right. So little bit about that, and then you're also trying to rule out if it is not anything insidious, because it could be any of the cancer meds also, for all you know.
Mm.
The important things, like the worst things that it can be, and it's an 80, 75-year-old man, so
Yeah.
definitely could be cancer. So you have to rule that out. So the flaws questionnaire, and is there any bumps anywhere else in the body? Because it could be, like
Mm.
I said, fibromatosis also, right? So you're trying to just understand, is it this just one place? Has this happened before? So once you have
Mm.
a comprehensive idea that it's not any of these dangerous things, then you ask a little bit about what his family situation is, because you feel like it's going into surgery. So when you have to operate
Mm.
on a patient who is 75, you need to understand a little bit about what kind of a home condition is he coming
Support. He's yeah.
from, right? Right. So
Yeah.
once you have that idea at the back of your mind, you have to address it. So you have to data gather for that, so that you can bring it back in your management. So initially, you start with the diagnosis. You explain what a dermoid cyst is, because you have to make him understand what that particular lump is that he's been living
Mm.
4 years of his life, right? In the beginning, you asked him ice. That was very good. But you should continue that line of questioning. Like, what is your main concern? He said it was the cancer. And
Mm.
from this consultation, like, what can I offer you today? Why have you come to me? So that you can actually give him what he wants. So he would be like, I want to take it out, or it looks, I don't like the way it looks, or it could be cancer. I don't want something like that on me, right? So that you can address that particular, concern why he's come there,
Mm.
right? So,
Yeah.
so once you explained him what it is, you've explained what it is. It is called a dermoid cyst, and it's abnormal tissues that have the potential to become anything, in your skin of your neck. So it has a tendency to keep growing, right? So I mean that's why you just explain a little bit about what to convey to him what it is. He also needs to understand what is that thing that is growing on him, and then ask him how this would be further managed. Like, I'm not the person who's going to manage it, so I'm going to be referring you to a dermatologist or a surgeon who will
Mm.
investigate it further, understand what it is. They may do a video examination and see what it is, what it contains,
Mm.
take few cells from it to see what kind of growth there is, right? Like FNAC, and
Mm.
FNAC and USG, you need to explain it a little bit, right? So that they
Okay.
understand what is going to happen to them. And then after they decide, looking at the extent of it, they can make a decision whether or not they'll remove it. Because if it is, because it has a tendency of growing, so it can go into surgery. Explain a little bit about the
Mm.
surgery. It's since it's a dermoid cyst usually have a daycare surgery. Tell them, it's done under the local anesthesia. A little bit about that. I mean, if the conversation goes that way, because there are
Yeah.
multiple
Yeah.
ways the conversation can go. Like, usually the question is, what are you going to do about it? So usually that is the route you need to take, looking at the location, looking at the size, right? The tendency for it to grow. So speaking dermoids is specifically, you should also explain about the fact that if you leave it there, it has a tendency to grow, so it might compress upon vital structures, or it can get infected. So these are things that can happen. And so even after you take it out, it may come back again, right? So that is
Mm.
the, if the diagnosis had gone, if you got it correct, those are the things specifically you have to explain about dermoid cyst. It depends upon what you say as your diagnosis. Like even lipoma also, it may also recur, it can also grow, right? So specific to
Mm.
that, and then you'll have to then he may ask a little bit about, will there be a scar or something, cosmetic things, or it may not go that way. But be prepared for such things, those that will be like completely understanding the case. But this is only when he asks for it. So he's like, do you have any
Yeah.
other, is there anything else that I can talk about? Like, once you explain him the surgery, what is the definitive management, I'm going to refer you, and this is what the surgeons will do. They will take a look at it. They'll do scans, further investigate it, understand what the growth is, and then they'll make a choice. I mean, make a decision on whether or not to operate it. The operation usually is like this. It's a daycare surgery where the surgery will be done on the same day, no recovery time, and there might be minimal scars according to how they do the surgeries. Those are usually the direction, such stations take.
Yeah.
And before you end every station, like we all say every time, when you hear the 2-minute bell, start forming in your head the last things, how to close the station. Like you have to talk
Mm.
about safety netting, follow up, leaflets, and pamphlets. So start
Yeah.
get right, if he's also not saying anything, then talk about the safety netting. So I'm going to be referring you, and in the meantime, if you feel that it's growing more very rapidly, or if you feel like there is loss of sensation in your face, or if you feel, you can talk about dysphagia if you find it difficult to swallow, or anything that it can affect you, please come back to the hospital immediately or call 999, right?
Yeah.
So start talking like that, and then if he has some concerns, we will come up with that. But always do eyes. It was very good that you started with eyes, but ultimately could not complete it. And
Yeah.
talk
So
about the
yeah.
follow-up, and finally leaflets and pamphlets. I'm sorry, you were saying.
Yeah, so my fear is if in some mainly derma cases, some pictures or some things may look the similar. So if I'm not able to reach the diagnosis correctly, so how do we do? How do we go with it?
So usually the route that we take is what most likely it can be, because at this stage you are not at the position to confirm say what it is, right? So in
We suspect it.
yeah, so you suspect it, but that's why I'm referring it to the surgeons, and they will confirm it. And usually for these kind of tumors, you explain what you said, right?
Mm.
So say that usually what I know for these kind of tumors is because it's benign, it doesn't have any potential to become cancerous. This is what we usually do. But since the location is there and it has tendencies that it can grow, that's why sometimes they may take it out. Because ultimately you're not the one who's actually doing it. You're still referring it. So, whatever
Mm.
provide, whatever the doubts they have, you have to, try to address that, you know.
Okay.
You look at it from that kind of an angle. But by just the main thing is, no matter whatever the conversation you have to make sure that nothing, bad happens to them. So you have to safety net, you
Mm.
have to give them leaflets, and you have to ask them for a follow-up just to make sure to see, how they're doing after 2 weeks or something. All right.
Okay. Yeah.
All right.
Thank you so
Well,
much for the feedback. It was really very
thank
eye-opening for me. So the
I'm
thing is, I
glad.
haven't seen this case before, so it's quite a new case for me. I haven't seen it yet, so it was like how will I approach if a new case comes up? So it gave me that thing.
That's good. That's good. I'm glad. I know
Thank
sometimes
you so
even
much.
exam I had like 4 new cases, and I hadn't even practiced them. I had never seen them, so I just went with the flow. How I would have approached it. If I knew the case. Yeah. Once you
Yeah.
have once you ask for a particular case, it'll come. I mean, very nice.
Mhm.
Good luck and
Yeah. Thank you so much for your time.
fun. Sure. Thank you very
Yeah.
much. So we have another session this Friday. So we'll post it on the group. Yeah. Hope to see you
Yeah.
guys there.
We are looking forward to it. Thank you so much.
Thank you so much. All right.